Councillor Moore, did you want to come first, seeing that you sent us the email?
I sent an email into the members group, but I don't actually know. I didn't know who was on that list, so I don't know whether Councillor Ringley received it or not. I did discuss it yesterday quickly. So I think it's better I just zoom through the email that I sent in if you haven't seen it. I'll try and do a condensed version. So I've been reviewing the report relating to the proposed West Norfolk Racket and Community Sports Hub. So first I want to make it clear that my questions I intend to argue against the principle of the project. Rather, they relate to evidence that underpins a number of the conclusions within the report. So, I mean, I'm a fan of paddle and the other stuff. I mean, I've literally spent all of Monday working on a paddle court consulting with somebody on the opening of one coming up soon. So it's not something I'm in any way against at all. I'm a big fan of it. But as one of the Borough Councillors for North Lynn, I took particular interest in the repeated references to North Lynn residents and those living in areas of high deprivation. So the report states that the hub will help attract underrepresented groups into physical activity, increase participation amongst residents living in areas experiencing the greatest health and socioeconomic inequalities, and specifically identifies North Lynn as a community that will benefit. These are significant and positive ambitions, and if they can be achieved, they would clearly be welcomed. However, having read the report, I've been able to identify the evidence that supports these conclusions. So, for example, the report states that the project will attract new participants, particularly those currently underrepresented in physical activity, increase participation amongst residents living in areas experiencing the greatest health and socio-economic inequalities, democratise access to racket sports for residents living in high index of multiple deprivation, areas such as North Lynn, and reduce inequalities through affordable community provision. So my questions are simply, and I'm actually not probably expecting an answer today, would be what evidence demonstrates that residents in North Lynn and other in high index of multiple deprivation wards actually want additional tennis and paddle facilities? Which residents and community groups or voluntary organisations were consulted before concluding that this project would reduce health inequalities? The report repeatedly refers to underrepresented groups. So which specific groups are these, and what baseline data has been used to identify them? And then what local evidence demonstrates that the affordable racket sports increase participation amongst inactive residents rather than simply providing additional facilities for those already participating in sport? Has any local demand analysis survey of community consultation been undertaken with residents living in the targeted areas? The equality impact assessment concludes that the project will be perceived as a highly positive targeted intervention. On what evidence is that conclusion based? And then finally, should the project proceed, what measures or key performance indicators will be used to demonstrate that these equality and participation objectives have actually been achieved? So as elected members, we all want to see investment deliver genuine benefits for our communities, and my concern is simply that where a report makes a number of positive assertions about social impact and health inequalities and community participation, it should also clearly demonstrate the evidence upon which these conclusions are based. So it would just be good to have some more evidence around those points, and if you don't have that email, which I did actually think you'd got, I can forward it to you.